Hi and hello everyone. Welcome to the Nursing Virus YouTube channel. This is me Loganathan and this video regarding the JIPMER Nursing Officer Examination, the memory based questions part 2. So for the part 1 you can go for my video description or you can check it on the top of that video, the link I have given. And if you so far not subscribe my channel, don't forget to subscribe my channel and click the bell icon so you'll get all my video notification. So in the part 1 I have discussed already that first 25 questions with all the rationals, and for this video also we are going to see with that 4 option and the suitable rational for the correct answer. So here we'll go. So the first question, the ABG analysis shows that the pH value is 7.34 and PCO2 48 mm of Hg and bicarbonate value 24 milliequivalent per liter. So here the 4 options: respiratory acidosis, respiratory alkalosis, metabolic acidosis and metabolic alkalosis. So for this question we should know about the shortcut, that is a ROM, that is a respiratory opposite and metabolic equal. So for the simple value, normal value here I given, that is the pH is 7.35 to 45. So the pH value is low according to that given value, and the PCO2 value is got increased, that is a 48, so it is increased, and bicarbonate value under the normal range, so that is the normal range. So it is getting opposite, so here you can check it. So when it is getting opposite, the person will have the respiratory, so hence it is an PCO2, that is a respiratory condition. So the pH value is low, so that is a acidic level. So the correct answer is, so respiratory acidosis is the correct answer for this question. So the next second one, the triple triad is, so the 3 major triad symptoms for depression they asked. The options are helplessness, worthlessness and thoughtfulness, and helplessness, hopelessness and worthlessness, and the third option hopelessness, mindfulness and thoughtfulness. So the thoughtlessness will not come and that thoughtfulness also will not come, so hence the remaining, the mindfulness also will not be considered. So that B option, if you are looking, there is a helplessness, hopelessness and worthlessness, always the person will use to express when they have the depression. So the correct option will go with the B. The next question, on the patient with a psychiatric condition receive carbamazepine drug, so this is one of the mood stabilizer, so which is commonly given for the manic client. So and the nurse found that on the investigation the carbamazepine serum level is 8 mg per deciliter. So and what would be the nurse next plan? So the options are stop the drug immediately, document and find findings and give the next dose of drug and inform the physicians immediately. So for answering this question we should know about the carbamazepine serum normal range, that is a 5 to 15 will be considered as the normal drug serum level in the body. So according to that lab investigation, the 8 mg per deciliter will be considered as normal. So the correct one is, we can just document the finding and we can give for the next dose of drug. So that will be the suitable answer for this question. And question number 4 regarding the GCS, they given the scenario. So in the emergency, the client admitted after an accident, so with a head injury. On the neurological examination, the client shows that the eyes are opening with the painful stimuli, and the client using the repeated use of sentence and withdrawing the limbs for the pain. So what will be the GCS score? So here, so the eye opening for the E, so the patient having the response to the painful stimulus, so that 2 score. And regarding that verbal response, the person going with the inappropriate words, so the 3 score. And for the motor response, the person going with the moving to the localized pain, so the score 5 will go. So altogether 2 plus 3 plus 5, so totally the 10 will be the GCS score based on this scenario. And the next one regarding that contraception, that is a newly introduced contraception method CHEA is. So progesterone pills, combination of estrogen and progesterone pill, and non-steroidal and non-hormonal contraceptive pill, and injectable progesterone. So this is the CHEA were newly introduced in that UK recently, and this is one of the non-steroidal and non-hormonal contraceptive oral pills. So this can be taken weekly once. The person can take weekly once. So it is not having much side effect on the hormone, and as well the steroid effects will be less common. So the next one, the oral contraceptive pills, if the person is taking, so what will be the common side effects? So the options are depression, insomnia, and vomiting. So the most common side effect of this drug is depression. So even the person may produce the nausea also, but not the commonly vomiting. So the depression will be considered as correct one. So, and seventh question, again that contraception. So what is the double touch method of contraception? That is a simultaneously use of condom and oral contraceptive, and use of female condom and using the vaginal touch. So these two method is the single method. So the double touch method will be considered as using of condom and as well using of oral contraceptive together. So the next one, aptitude side. So find the next number in the series 5, 11, 21 and 36 and 56. So just we can go with the connectivity of 6 to 11. So if you are minusing, the person will get the 5, and 11 minus 21, the person will go with the 10, and 21 to 36 will get the 15, and 36 to 56 will go with the 20. So most probably the 5 series were coming, so the next number we need to plus with the 25. So if you are 25 plus 56, so we may get 1 and 8, that is a 81 is the correct series, next series for this option. Ninth question, a 15 years old child admitted in the pediatric unit with a rheumatoid fever, which intervention will alleviate the person from this problem? So just they are asking how we can relieve the person from this major problem, and the options are keep the both legs in the extended position, keep the legs in the flexed position, use the bed cradle to prevent the linen weight over the joints, use the rolled sheet under the leg to comfort. So commonly, so anything which is covering the joints of the patients can be avoided commonly in the rheumatoid patients. So using the bed cradle will be the best remedies for alleviating the patient from this problem. So the option C is correct one. And the 10th question, according to the WHO guidelines, the active stage of labor care need to be started when? So active stage of labor care. So from the second stage of labor, and cervical dilatation is 2 centimeter, cervical dilatation is 4 centimeter or more than that, or from the active painful contraction. So when that cervical dilatation is getting 2 centimeter, we will wait for the furthermore dilatation, and it will not begin in the second stage. And even with that one pain contraction, we won't start the active stage of labor. So when that person having the 4 centimeter or more than that cervical dilatation will start with the WHO guidelines for carrying the woman. And the next one, the child with a severe headache and fever and stiff neck and the physician suspect for the meningitis. So what will be the confirmatory findings for this patient? So the options are lumbar puncture, EEG, X-ray and meningomyelogram. So we don't have such kind of examination, so we can eliminate this option and directly we can go for measuring that confirmation of meningitis. The lumbar puncture is the ideal remedy for identifying the confirmatory test. The next one, ergometrin is contraindicated in preeclampsia, preterm labor, gestational diabetes and postterm labor. So the ergometrin is always contraindicated when the patient is having increased level of BP. So in the preeclampsia we know that the person is become a increased blood pressure level. So directly you can go with the option A. The next one, the rotation of the trunk of the fetus during a breech birth to facilitate the delivery of the extension of fetal arms and the shoulder. So which type of maneuver is used or name of this maneuver? So Wood's maneuver, Lowset maneuver and Roberts maneuver. So here, the Wood maneuver is the physician will use to utilize to delivering the baby from the birth canal when they have the shoulder dystocia. So in case of an Roberts maneuver, to correcting the shoulder in the case of dystonic client on the baby from the birth canal. So that Lowset maneuver is appropriate method in case of breech birth or a breech position or breech delivery. So 14th question. So the patient with a right leg tibia and patella fracture, to make the client mobilize, what is that expected nursing action? Then the passive range of motion to the hip and knees can be flexed, extension of the legs and quadriceps sitting. So the passive range of motion exercise to the hip will not do and knees can be flexed. It will not permitted in case of tibia and patella fracture, and the extension of the leg also we won't do. So what is the best remedy is we can make the patient to go with the quadriceps sitting. So just we can roll over that sheet and we'll use to place under the knees. So then the 15th question, after the cleft palate surgery with the 2 days of a post-operative surgery, which of the following feeding is preferred? So the first one is a rubber tipped syringe or by using the cup. So you won't give the milk in the cup. So the rubber tipped syringe can be the best remedy for the cleft lip palate. So in the 16th question, patient in that emergency, direct stab wound on the left side of the chest and excessive blood loss, and that patient shows that the blood pressure is getting low, that is 80/45, and heart rate is 110 beats per minute. So what may be the expected diagnosis? So here when you are observing the blood pressure, it is getting down, and the heart rate, the person getting the tachycardia. So it is the direct sign of the hypovolemic shock. And the next question, the child with a seizure receiving the phenytoin for the treatment. So what would be the effective teaching for the mother to care of the baby at the home after the discharge? So ask him to brush the teeth after each meal and drink the plenty of fluid and monitoring the WBC count. So the major health teaching what we'll use to give to avoiding that when the patient taking the phenytoin, that mouth care is must for this patient because they may use to develop the bad odor and gingivitis can be formed. So we can make the patients to brush their teeth after every meals. So 18th question, female client with a positive human papilloma virus show which of the findings? A painless ulceration on that vulva, a foul smell vaginal discharge, an irregular wart on the perineal area, and ulcerative wound on the vulva. So commonly on the papilloma virus, the wart formation is more common. So on that irregular wart on the perineal area option we can go on. The following symptom not commonly seen in the HIV infected patients. So we need to note down, not seen in the HIV patient. Fever can be seen, and swollen glands also can be seen, and sore throat also can be seen. So that gingivitis is less common in case of HIV patients. So the correct option is gingivitis. So next one, the expected complication of Kawasaki disease is mitral stenosis and atrial aneurysm. So we know that the Kawasaki disease mean that is that increased blood flow to the heart, so that atrial aneurysm can be seen commonly as a complication of Kawasaki disease. So that aneurysm, we know that is the enlargement of the arteries over the blood circulation area, mainly in the artery area. So a 15 years old client admitted with a history of congestive heart failure with a crackers sound on the auscultation and distended neck vein and difficulty in the breathing. So what is the prioritized nursing diagnosis will go? So they maintain that skin integrity and excessive fluid volume and disturbed daily living and difficulty in the breathing. So in case of a congestive heart failure, the cardiac system will get the overloaded. So that's why the person have the major symptoms of distended neck vein. So the important thing is we need to give the importance for the excessive fluid volume. So we need to reduce the overloaded fluid. So next one, a woman with multiple pregnancy, the one twin dies and is absorbed by the other is known as, so the option, the correct one is vanishing twin syndrome. So one baby will used to get died within the uterus and another baby will used to get absorbed when it is getting grown up within the uterus period. So next one, initial post-operative assessment after that ventricular peritoneal shunt is check for that CSF leakage, continuous fever, check that urine for the sugar and protein, and administer the narcotic for the pain control. So actually that checking the CSF fluid also is necessary, and continuous fever is very highly noticed symptom for the infection, and check the urine for sugar and protein, it is less commonly done. So administer the narcotic for the pain control, we want this also. So among this the most priority we can give it for the continuous fever, so because that is the common sign for the infection over the peritoneal shunt place. In 24, a woman is admitted for the labor and she has android pelvis with ischial spine is prominent. So what is the expected complication during the childbirth? So the android pelvis, we know that is a kind of an male pelvis. So the options, the pelvic fracture, shoulder dystocia and uterine rupture. So during the delivery time, so most of the delivery when their woman is having android pelvis, mostly they used to go with the LSCS preference. So but suppose if they are delivering, unfortunately the uterine rupture is very common in case of android pelvis. So last question, so how many hours after the cesarean section for the breastfeeding should be initiated for the baby from the mother? The options are 30 minutes, 1 hour, 2 hour and 4 hours. So already I said that the 30 minutes will be considered for the normal woman. So in case of LSCS, so after the 4 hours will be given the most preference. Why mean? To reduce the anesthetic effect for the baby. So for the LSCS, the 4 hours can be considered as normal, correct answer. If they are given for that normal breastfeeding woman, that is the normal vaginal delivery baby, within the 30 minutes we can go on. So that's all for the next 25 question. So for checking the first part, you can go for the my video description. You will see the first 25 questions with all the rationals and 4 options and correct response with the rational. So thanks for watching this video, and we'll upload the next video part soon. Thank you.